right, let's move on to Proposition 34.
Okay, great. Can everyone hear me? All right, awesome. So Proposition 34 creates new rules on certain kinds of healthcare entities like clinics, pharmacies, or health insurance plans. And specifically, it would create new rules around the money that these entities earn from a federal program that provides them discounted prices on prescription drugs. Healthcare entities earn money from this program because they get reimbursed by healthcare payers, such as health insurance plans. They get that reimbursement's higher than the discounted price of the drug that they purchased the drug for. And currently, there are no federal or state laws that directly control how entities spend this money. And so this would reflect a change in law by creating new rules in state law. Now, under the measure, entities would have to spend at least 98% of this money on healthcare provided directly to patients. And entities that do not meet these requirements would face certain penalties, such as loss of tax-exempt status or loss of licensure. One key thing to keep in mind about this measure is that it doesn't apply universally to all entities. Instead, the rules would only apply to the entities if they meet certain conditions. If you have your voter guide available, on page 47, figure 1, we summarize the 4 conditions that an entity would have to meet for the rules to apply to them. Just as an example, in addition to an entity participating in the drug discount program, the entity would also have to own and operate multifamily housing units and have a certain number of violations. And that's just one condition of a few that are listed here. Given these conditions, it's likely that few entities would fall under the measure's rules, and you can just imagine already, few healthcare entities already operate and provide housing, so already that is a limiting factor, and then there are several other factors that would apply too. In terms of the fiscal effects, this measure would create costs to the state to enforce the measure's new rules, which we estimate to be in the millions of dollars annually. The measure allows the state to cover this cost by charging fees on entities that are affected by the rules. Now, there are a number of other fiscal effects that could happen as a result of the measure. We walk through some of these potential effects on page 49 of your voter guide. Generally, they would depend on how the measure might affect healthcare entities' behavior around how they spend this money, or to the extent an entity is found to be in violation of the rules, that there could be effects there. These effects are uncertain, but generally would be limited on a statewide basis, and that's again because likely few entities would fall under the measure's rules. Thank you.
All right, so this one is pretty unusual in that the petition signatures were gathered by a trade group for California's landlords, which seems odd for this sort of a measure. And the reason is that it is tailored to apply to only one organization, the AIDS Healthcare Foundation. Okay, and that's the one that was responsible for the previous measure that was about rent control. So it's a targeted measure at one particular organization, which is very rare. And that's why some organizations are opposing it, not on the substance, but based on the targeting factor. So in support, we have the California Apartment Association, ALS Association, Assemblymember Evan Lowe, Howard Jarvis Taxpayers, California Chamber of Commerce, and the Republican Party. And then in opposition, the AIDS Healthcare Foundation, of course, and then the Consumer Watchdog. Support is the Southern California News Group, and then in opposition for newspapers, we have the San Francisco Chronicle, the Mercury News, San Diego Union Tribune, and the LA Times. And then in support, we have basically it's realtors and rental operators organizations. And then in opposition, we have the AIDS Healthcare Foundation and a specific group formed for this, and the Pro-California Action Fund. So there's more money for this than against. That's sort of almost a little more than double that's for it. So you may see lopsided campaign advertising as well. Questions?
This was one of those that was really confusing for me. I just couldn't understand what the whole point of it was. And when you said that it was targeted to one group. I guess, can you explain that a little bit more? Because I'm still kind of fuzzy on what they're trying to do.
Well, it's structured such that it only applies to that one group, so there are lots of very specific requirements, as the LAO was mentioning, and it just happens to be the case that only the one group ends up fitting all the criteria. And it seems to be essentially targeting them because the landlords don't want rent control, and the rent control measures keep being sponsored by the AIDS Foundation. All right. I haven't seen one like this before, so, here we are.